Hello everyone, welcome to ManpreetRN Talks. So, if you are struggling with the nursing exam questions like NORCET, NCLEX, or CBT, don't worry, you are at the right place. So, where we are practicing smart questions, learn fast, and move one step closer to your passing NCLEX, NORCET, or CBT exam. So, today we are going to do practice question on endocrine system. So that definitely comes in your exam. So if this video really help you, so kindly do subscribe my channel, comment and share this video with your nursing friends. Question number one, the nurse is caring for a 25-year-old patient admitted to the acute care unit with an extra strong thirst and dilute excessive straw-colored urine output up to 15 liters per day. So what does the nurse suspect? Type 2 diabetes, diabetic insipidus, Cushing disease, addition disease. So correct answer will be what you think. So correct answer this is DI, diabetes insipidus. So what is diabetic insipidus? Diabetic insipidus is a disorder of the posterior pituitary gland in which what happened, water loss is caused by either an ADH, antidiuretic hormone deficiency, or an inability of the kidney to respond to ADH. So as a result of DI, in the excretion, there is a excretion of large amount of diluted urine because the distal kidney tubules and the collecting ducts they do not reabsorb the water. So this can lead to polyuria. So dehydration from massive water loss increase the plasma osmolarity. So which further stimulate the sensation of thirst. So thirst promote increased fluid intake and it aids in maintaining hydration. So correct answer is DI, diabetic insipidus. Next question. The nurse is providing care for a male patient with hypogonadotropin. So, who is receiving sex steroid replacement therapy with testosterone? So, nurse is providing care to a patient with having hypogonadotropin. So, who is receiving sex steroid replacement therapy with testosterone? So, which changes indicate to the nurse that the therapy is successful? Means the steroid therapy that is successful. So, select all that applied. So in this we have to choose the answer from then we can guess that the therapy that is going good. So decrease facial hair, increase libido, decrease bone size, increased muscle mass, increased axillary hair growth, increased breast tissue. So correct options are increased libido, increased muscle mass, and increased axillary hair growth. Why? So, therapy for the gonadotropin deficiency, it begins with the high dose of testosterone and it is continued until the virilization. So, virilization means presence of male secondary sex characteristics that they are achieved. So, with the responses that they include increase in penis size, libido, muscle mass, bone size, and bone strength. Chest, facial, pubic, and axillary hair growth that also increase. And patients usually report improved body image after the therapy is initiated. Side effects of therapy include gynecomastia. It means male breast tissue development. And patient may have acne, bladness, and prostate enlargement. So these are the symptoms after the therapy is received, and patient will have these all the symptoms. Next, very important question. A patient is admitted to the medical unit with the possible grave disease. Grave disease means hyperthyroidism. So, which assessment finding by the nurse for this diagnosis? Periorbital edema, bradycardia, exophthalmos, or rush voice. So, think what will be the correct answer for this? So, correct answer for this is exophthalmos. So it means abnormal protrusion of the eyes. That is the characteristics of patient with the hyperthyroidism caused by grave disease. Periorbital edema, bradycardia, and hoarse voice that all are the characteristics with patient with they are with hypothyroidism. Next question. Which change in vital signs would the nurse instruct the unlicensed assistive personnel UAP to report immediately for a patient with hyperthyroidism? Rapid heart rate, decrease systolic blood pressure, increase respiration rate, decrease oral temperature. So correct answer is rapid heart rate. Why? The cardiac problems associated with the hyperthyroidism, it includes tachycardia, increased systolic blood pressure, and decreased diastolic pressure. So patient with the hyperthyroidism also have increased body temperature related to their increased metabolic rate. So respiratory changes are usually not symptomatic of this condition. So as a delegation supervision purpose of this, UAP should report immediately if the patient is having increased heart rate. So next very important question. For a patient with hyperthyroidism, which task should the nurse delegate to the UAP? Means unlicensed assistive personnel that is experienced. Means the what which task should the nurse delegate to the experienced, unlicensed, and assistive personnel? First, instructing the patient to report any occurrence of palpitation, dyspnea, vertigo, or chest pain. Monitoring the apical pulse, blood pressure, and temperature every 4 hourly. Option third, drawing blood to measure levels of thyroid stimulating hormone TSH, triiodothyronine T3, and thyroxine T4. Option 4, teaching the patient about the side effects of the drug propothyroidism. So what would be the correct answer for this? So correct answer for this is the 2. Monitoring the apical pulse, blood pressure, and temperature every 4 hourly. Why? So what is the scope of UAP? So what can the UAP done? So as we remember, so UAP can do vapor. So means vital signs in the vapor mnemonics vital signs. So monitoring vital signs and recording their values are within the education and scope of practice of the UAP. And experienced UAP should have been taught how to monitor the apical pulse. However, a nurse should observe the UAP to be sure that the UAP has mastered that skill, means they are doing properly. And in instructing and teaching patient as well as performing manufacture to obtain laboratory samples are more suited for the education and scope of the licensed nurse. Next question. As the shift begins, the nurse is assigned to care for the following patients. Which patient should the nurse assess first? So that is the prioritization question. Option A, a 38-year-old patient with the grave disease and heart rate of 94 beats per minute. Second option, a 63-year-old patient with type 2 diabetes and fingerstick glucose level of 137 mg per deciliter. Option third, a 58-year-old patient with hypothyroidism and heart rate of 48 beats per minute. Option 4, a 49-year-old patient with Cushing disease and dependent edema rated as +1. So think what will be your answer. So correct answer for this is option third. A 58-year-old patient with hypothyroidism and a heart rate of 48 beats per minute. Why? So, although patients with hypothyroidism often have cardiac problems that include bradycardia, so a heart rate of 48 beats per minute may have significant implication for the cardiac output and hemodynamic stability. So, patients with grave disease usually have a rapid heart rate, so but 94 beats per minute is within the normal limits. And the patient with diabetes may need sliding scale insulin dosing. So this is not the urgent. And the patient with Cushing disease have they frequently edema. So it is also not a priority. So option third will be the priority. So next question. A patient is hospitalized with adrenocortical insufficiency. Which nursing activity should the nurse delegate to UAP? Reminding the patient to change position slowly, assessing the patient for muscle weakness, teaching the patient how to collect a 24-hour urine sample, revising the patient's nursing care plan for care. So correct answer for this is 1. Reminding the patient to change position slowly. So, patients with the hypofunction of adrenal gland often have hypotension and should be instructed to change their position slowly. So, a patient has been so instructed, so it is appropriate function for a UAP to remind the patient for the instruction. So, assessing, teaching, and planning. So, this is not for UAP. So, it is always done by the RN. So, correct answer is for the delegation purpose. This is the first. Next question. Assessment finding for a patient with Cushing disease include all the following. For which finding would the nurse notify the healthcare provider immediately? Option 1. Purpose present on the abdomen and thighs. 2. Weight gain of 1 pound since the previous day. And the third one is dependent edema rated as +1 in the ankle and calves. Fourth, crackles bilaterally in the lower lobes of the lungs. So, what do you think? What will be the correct answer for this? So, correct answer for this is the fourth. Crackles bilaterally in the lower lobes of the lungs. So, what is Cushing disease? So, it is a type of Cushing syndrome. So, especially it is caused by a pituitary tumor. So, in which there is secretes too much ACTH, adrenocorticotropic hormone, and then which then makes adrenal glands to produce more excessive cortisol. So in the Cushing disease, so there is pituitary problem, increased level of ACTH, and there is increased cortisol in the body. So excess cortisol can cause mainly patient will have body disease like moon face, buffalo hump, truncal obesity, papasteria, and weight gain. So this is the third one, that is the unexpected symptoms. So it is so the presence of crackles in the patient's lungs means it indicates there is excess fluid volume that is caused by excess water and sodium reabsorptions and may be symptom of pulmonary edema, so which must be treated immediately. And the other options like stretch marks, and weight gain dependent edema, as I have discussed earlier. So these are the common findings in patient with Cushing disease. So these findings should be monitored but do not require any urgent action. So as a prioritization, so finding the nurse that should immediately report to the HCP are those symptoms that can indicate a worsening of the patient's health condition. So that must be treated to prevent further worsening or their threaten to the life. Next question. The nurse is preparing to discharge a patient with hyperpituitarism. So that is caused by a benign pituitary tumor who is prescribed the drug bromocriptine. Which key points would the nurse teach the patient about this drug? Select all that apply. Take this drug with meal or snack to provide GI symptoms. Side effects of bromocriptine include severe fatigue and reflex after meals. Seek medical care if you experience chest pain or dizziness while taking this drug. If the drug causes headaches, you can take over the counter acetaminophen. And fifth one, treatment starts with the high dose, which is gradually lowered. And the purpose of bromocriptine is to shrink your pituitary to normal size. So what will be the correct answer for this? Option 1, third, fourth, and sixth. So as a rationale, bromocriptine is a dopamine agonist drug that stimulates the dopamine receptors in the brain, and it inhibits the release of growth hormone and prolactin. So in most cases, small tumors decrease until the pituitary gland of its normal size. So side effects of bromocriptine include orthostatic hypotension, headache, nausea, abdominal cramps, and constipation. So always give bromocriptine this drug with a meal or snacks to reduce GI side effects. And treatment usually start with a lower dose and it is gradually increased until the desired level it is reached. And patient and who is taking bromocriptine should be taught to seek medical care immediately if they are experiencing chest pain or dizziness or watery nasal discharge. It occurs because of possibility of serious side effects, including cardiac dysrhythmia or coronary artery spasm or maybe cerebrospinal fluid leakage. And also, if a patient is female or childbearing is who becomes pregnant, the drug should not be taken. So immediately the drug should be stopped. So these are all are about bromocriptine drug. So bromocriptine, that is a dopamine agonist, means it inhibits the release of growth hormones and prolactin. So friends, that's all about the practice questions on endocrine system. So that is very important. So practice with Manpreet RN Talks. Catch the concept, boost your confidence and pass NCLEX CBT or NORCET. So whatever exam you are preparing, 100% success in your first attempt. So learn smart, practice daily and catch your success with Manpreet RN Talks.